Breast augmentation is a procedure that is done to enhance the size of one's breast as well as improve the overall shape and symmetry. There are 4 elements that go into any breast augmentation. Number 1, the incision. Although there are 4 types of incisions, that is, through the belly button, through the armpit, through the areola, and through the crease of the breast, I myself am partial only to the areola and the crease. I get consistently excellent results using these techniques. Number 2, the location of the implant relative to the muscle. If you do your research, you will find there are 2 options, above and below the muscle. Above the muscle, the implant often looks very fake. Below the muscle, often the implant looks a bit flat. However, there is a third option. It's known as the dual plane, in which the implant is partially above and partially below the muscle. This dual plane technique will allow the implant to have a more teardrop or natural appearance. Number 3, what type of implant? There are 2 main types of implants, saline, silicone. The most important thing, of course, is safety. Based on many years of research, we now know that both saline and silicone are safe. So, the next issue, which feels more natural. For most patients, the silicone implant is significantly more natural and soft and often the better choice. Number 4, the issue of size. Size has to do with what the patient wants, what the doctor recommends, but the only thing that really matters is the patient's anatomical measurements. Many doctors decide on size based on what the patient wants, even if it isn't necessarily what fits their body frame. Size is one of the most common causes for people to go back to surgery. Therefore, I spend a lot of time trying to figure out correct sizing. There's no single standard method of determining size. One method, of course, is based on what the patient says. Another is based on their measurements. And finally, third, photographs that the patient may show you. I help patients make that decision. I believe you need to use sizers during surgery in order to figure out what is the best size for the patient. And this takes time in the OR, which, as we know, is not very popular. Many surgeons do breast augmentations quite quickly, as they have several to do in a day, but it should take approximately 2 hours. Next, let's talk about recovery. Pain is often mild to moderate. You can return to a desk job after a week. No lifting or any heavy cardio for approximately 4 to 6 weeks, after which time you'll go back to life as you know it. Remember, implants should be replaced every 10 to 15 years. Finally, the most important thing you need to know are the risks. Bleeding and infection, quite infrequent. Scarring, which of course is a major concern, really depends on 2 things. Half of it is your surgeon's responsibility. Half of it is your biology. It's very important that your closure be quite fastidious. Unfortunately, many surgeons are allowing their tech to close half the incisions, which, as you can imagine, will lead to less than ideal scars. Asymmetry, yet another risk. While the breasts will never be exactly the same, they should be pretty close after surgery. Loss of sensation, a major concern for patients, has nothing to do with the incision. Often patients think that if you go through the areola, you will lose sensation. This has nothing to do with it. It has to do with damage to a nerve in the armpit, which occurs when you pick too large of an implant. Decreased breast milk, yet another concern. It may occur if you go through the areola, but not if you go through the crease, as you will avoid the gland completely. Rippling is actually quite common, especially in thin patients. Usually it occurs on the outside of the breast near the armpit. You can usually feel it, but not see it. Rupture is actually much less common now that we have these excellent implants. And finally, now listen up, capsular contracture. Capsular contracture occurs in about 5 to 15% of patients and is something you definitely need to know about. Every patient who puts an implant in their body, whether it be a breast implant, a pacemaker, a prosthetic knee, will form a capsule or scar tissue around it. This is not a rejection. Most women create a soft capsule and every woman has it. Some women make a thick or firm capsule, which then leads to a hard breast and a breast that's often elevated. If this happens, unfortunately, the only solution is to reoperate and remove that scar tissue. One new advancement that has greatly helped reduce many complications is a device called the Keller funnel. It is a device that allows a silicone implant to slide into the breast pocket through a small incision with great ease. Prior to this, surgeons had to force the implant into the pocket, therefore damaging the skin and also injuring the implant. You have to ask your surgeon if he uses it, as he may not, because there is a nominal additional cost. I hope you found this comprehensive explanation of breast augmentation useful, and make sure you ask the right questions when you go to your next consult.